The New York Times is reporting that the president had a fever, congestion, and cough. By now, we've seen all the headlines. President Trump has COVID-19. Same for the First Lady. Adiane Till sat down with a medical professional and a former Obama administration biodefense advisor to break down what this all means.
Bruce, I started that conversation off by asking, how serious is the president's risk for complications of COVID-19? Bruce, I started off by asking the doctor, how serious is the president's risk for complications of coronavirus?
Yes, he is in the high risk category. One, let's discuss his age. We know with age, they're at higher risk, significant higher risk. In addition, his weight, when you look at his body mass index, he is over that, and that also places him at risk again.
So what does the virus incubation period mean for its spread, and what about testing?
We're seeing with COVID-19, there's an incubation period that can last up to 14 days. In some cases, some have been outliers up to 21 days. Just because you get a snapshot in one particular time doesn't mean you're negative for that period, for a longer period of time. You have to look at it. That's at one moment in time. Right here, right now, you're negative, but that could change.
What level of transparency can the public expect from the White House when it comes to health updates about the president?
That's a physician-patient relationship that has to be respected. However, the caveat is this is the leader of the free world. And so for the president, it behooves the government to be transparent about that information to the American public.
So what call to action does this signify for the public and for the president?
We've been giving out the public health message: wear a mask, social distance, avoid congregating, all which the president pretty much has ignored. And that's being perfectly candid on what we've been seeing. But I think this is a key point for him to pivot accordingly. He needs to use that as an opportunity to reignite the whole American public in terms of defeating COVID.
I also asked Dr. Fagbuyi about his biggest concerns right now, and he says he is alarmed by the mix of politics and science. He says with climate change and social injustice leaving a lot to anticipate, politicians have to put public health before policy in order to effectively lead.